Do you want to make over €700 a week working as a healthcare assistant and working less than 39 hours? Well, stick around and I will tell you how you can do that. When I first started out working as a healthcare assistant, I used to work for a nursing home and I used to work for €10.50 an hour. When I left that nursing home, I was now making €13 an hour as a senior healthcare assistant. However, as much as I really enjoyed working in that nursing home and really enjoyed spending time with my residents, I was underpaid considering the amount of work that I did. Today, I am going to tell you how I went from making €10.50 an hour and started to make €18 an hour. When I left the nursing home that I was working for, I went and signed up with an agency. The main reason why I signed up with an agency, I wanted flexibility when it comes to my shifts. So working in a nursing home, you don't really have a say. Yes, you can ask that can I work certain days, because the industry is severely understaffed. Most nursing homes may try and accommodate you, but it's still not guaranteed. They do need to put you on a certain roster that is not only beneficial for you, but beneficial for your colleagues as well. So I needed to join a company where I would have flexibility in terms of those shifts. So I signed up with an agency, because working as an agency staff, you can choose the days that you want to work, which was absolutely brilliant and convenient for me as a person who is a mother as well. So I made €700 a week, working only 3 days a week. That was 2 night shifts and 1 day shift a week. Although I do not like night shifts, I chose to work night shifts as they do have a higher rate in comparison to day shifts. So because I was starting out with this agency, they only started me at €18 a shift working nights. You could get a higher rate if your negotiating skills are better, and you could negotiate for a higher rate once you're with that agency for 6 months. So I started off only doing 2 night shifts a week, getting paid €18 an hour for €18 an hour for 12 hours shifts. So I did a total of 2 night shifts. And I picked and choose which days were convenient for me which nights were convenient for me during the week. Once I did that, I went on and picked up 1 Sunday shift during the day. So I worked 2 night shifts during the week, and then I worked Sunday a day shift. The reason why I worked Sunday day shift is because I wanted to be paid a higher rate on Sunday, and that higher rate applied from the early hours of Sunday morning up until I think it was 10 p.m. Sunday night. So I usually just worked 8 a.m. to 8 p.m. on Sundays, and I was paid 25% more than my nightly hourly rate. So I would get around €22.50 per hour on Sunday. So putting all those amounts together, I would make €270 for Sunday on a 12-hour shift, that is 8 a.m. to 8 p.m. Then I would work €18 per hour for 2 night shifts during the week, which came to an equivalent of €432 for the 2 nights. Putting those totals together, I would come back at €702 for the whole week that I would have worked. Some of the advantages of working for an agency, like I've said, is that you can pick and choose the shifts that you want to work. The disadvantages is that there are seasons where it's not very busy. So usually when there is a lot of, when student nurses are doing their placement, they usually go to nursing homes, they go to hospitals, and because of this, hospitals and nursing homes utilize them as an extra hand, and they do not need to hire agency staff. So because of that, you would not get shifts on those seasons. But what I would suggest is that all you have to do is just save up on your leave days if you can, and then take your leave during that window when it is less busy, and pick up shifts when it is during the busy period. But Ireland is severely understaffed in terms of the healthcare industry, that even during that time when they have student nurses and healthcare assistants doing their placements, they still have enough shifts, but you cannot pick and choose as much the shifts that you want. Another, going back to the advantages of working for an agency, is that most of them place you in hospitals rather than in nursing homes. You can even choose that, can I be in a hospital instead of a nursing home, and they will accommodate you if they can. The reasons why hospitals are more convenient to work in is that it is less physical, less harder on your body, because when you're working in a hospital, there's more staff around than in nursing homes. Nursing homes, people, permanent staff ring in sick like an hour before the shift, which is less prevalent in hospitals. Most of the times when you go into a hospital, they need you as a one-on-one for those patients who have dementia. Instead of being in a nursing home where you're looking after 10, 15 people on the night, you're just looking after this one person. So it's less physical on your body, and because it's night shift, most of the time the person is sleeping and you just have to check that they're okay every hour without disturbing them and waking them up, just to make sure that they're okay. And you obviously have to watch them, be with them, and just make sure that nothing happens, and alert the staff nurse if there's anything concerning. So it is less physical on your body. The downside again is that if you're not a person who can sleep like that, night shifts will not be your best friend. When I was on night shifts, I struggled a lot with insomnia. I have done a video on this. I struggled a lot with insomnia, and I would work a 12-hour shift. I would be awake the whole 12 hours, and then I would come home and I would struggle to go to sleep. Like, I would get into my bed and I would close my eyes, and I was lucky if I got 2 hours straight sleep. And that's just how my body is. No matter how tired it is, I'm just not great with sleeping during the day. There are things that you can do to make sleep come easier, but for some people like me, it just didn't come easy. There were days when I came from a night shift and I was awake the whole day and I still had to go to work, and that took a toll on my body physically. But when I was an agency staff, what I enjoyed is that I only had to do 2 nights, so I only had to power through these 2 nights, and that was it. And you may wonder, when it comes to the Sunday day shift, that if it's paid a higher rate, can I actually get a shift? The answer to that is most likely yes. So most people usually don't want to work weekends because they want to spend time with their families. If you're a single person or a person who doesn't mind sacrificing that Sunday, then that works ideally for you. So usually Sunday shifts, even though they're paid a higher rate, they are available. They are still available. I know people who, when I was working for the agency, who were permanently on Sundays. Like, they were rostered always somewhere on Sundays because the agency knew that they wanted Sunday shifts and they were available for Sunday. Another thing with Sunday shifts is that public transport starts late on Sunday. In some areas it starts at 9 a.m. So most staff who use public transport can't actually make it to work on time on Sundays. But if you live in close proximity to the hospital that you want to go to, and you're able to get a shift for Sundays on to that hospital, and you're able to walk, or if you have a car, or if you can arrange with other with other people, and you can get a lift every Sunday to work, then that would be ideal for you. So because of that, there's more shifts that are free, because some people want to stay at home with their families. Another bunch of people can't come to work because of transport issues, and as well some people can't come to work because of childcare issues, which frees up a lot of Sunday shifts. That is it, guys, with how to make €700 as a healthcare assistant.